episode again. Good morning of Yes Way Jose, and I keep saying I like doing the program. You think do I get reviews for this?
Yeah, you keep telling that you keep saying that you like it. You keep saying that you like being the host.
I'm not sure about the staffing yet.
No one's trying to fire you.
Right. Well, we only know we get fired if people are actually viewing
yeah, right. Yeah.
That's how we get fired.
Yeah, he comes on here and he's just like, please just let me keep doing this. I like it. And I'm like, no, you have to.
Yeah, I've known a little while. It's not shocking he likes being the host.
Yes, I do. I do. I like my name being the host. Good morning to everybody. We want to make sure you know that obviously we have a lot of fun with the show. We're trying to make sure that people actually get to meet the Shaker and Movers, and I got a Shaker and Mover here for you today. I think it's important, though. We obviously start with our email address and review.
It's yeswayjosemail@gmail.com.
Yeah, and obviously you can reach out to me. Obviously, I work at City Hall.
Yeah.
And so, if they want to reach out to me here or that email address.
You probably even got like a personal email they can find online.
They can find me out on that webpage.
Like the official complaint department.
Right, yeah.
Absolutely. That's what I do. People ask me what I do. I'm a janitor. I'm always cleaning up messes. But I do think it's important. Good morning, everybody. And obviously, every time we get in these shows, we want to make sure that people get an update on what's going on. So really for us, we talk a lot about the progress. So that we're in May, and by the time this gets out, we're talking about July when these episodes come out. But there's going to be a lot of things moving. People have already seen dirt moving, and if you haven't seen the aquatic center yet, and I think they called the police on me twice.
Oh, really?
Yeah, for stalking.
Just driving by.
There's a guy going by. We think it's the mayor. But I do think it's important. I go by every day, and if I have to go anywhere on that side, I'm taking Joby home going that way.
Yeah, I pretty much drive that way every day to and from work, so it's nice to see the progress.
Yeah, and I think for most people here, that's a part that's important, because I think the thing that I see is, all these meetings and you talk about this money, but now they're getting to see things. And I think with the work we're doing in the park, we got some really cool things there. And obviously the 5K, we're going to move it to a different day because of just all the flooding and everything we're doing in the park. So that's going to all be taken care of. So we're going to keep doing things that obviously are health-based because that's what you do. But I think it's important for people to know that we're excited about all the changes, but I'm also excited about all of the other community leaders here. And we have a gentleman we want to introduce you to, is a gentleman that does a lot of things, and he's been a shaker and mover since he started with the Board of Health. And so good morning, Rob Flaherty.
Good morning.
And if you want to take a few minutes now, just talk a little bit about yourself and where you grew up and all the good stuff, and a little bit about your background. I think people don't realize exactly the extent of your background. But listen, please, just a good morning, and why don't you tell everybody a little bit about yourself?
So I think when you talk about my background, that just means I'm getting older.
Yes.
I've done a lot of stuff.
Yes. I mean, you really came into here without your walker. That was remarkable. That was amazing that you did that today.
Today's one of the good days.
Yeah, okay. That's great. Oh, good morning.
Good morning. I appreciate the opportunity. Bullitt County's my home. Was raised here. Went to Brooks Elementary, Bullitt Middle School, and graduated from Bullitt Central.
Oh, yeah.
So, went away to school for a while, but and then worked. Went to law school and started out prosecuting Jefferson County.
He's one of the lawyers I like.
The very small list.
It's a small list, but he's on the good list.
Exclusive club.
No, I'm just kidding.
Yeah, so I had a chance to come back home. I think it was late 1998.
Oh, yeah.
To work, and been here ever since. So I've been in many positions. I've been deputy judge executive. Assistant county attorney. Been county attorney. And then a little over 2 years ago, I took over as public health director for that department.
And I think it's real important. I mean, obviously, you've got an extensive background. But Rob, I think what you've started doing and really building a system, building a good communication line about what you actually do at Bullitt County Health. And I think that's important for us.
Yeah, I was fortunate. I mean, I walked into a situation where I had just a tremendous staff, a great group of people, and a lot of potential there. And I think that, with public health, we don't even want to mention the evil 5-letter COVID word, but it drained a lot of people. It took a lot out of it. So I think there was just a little uncertainty about where things were going. There were some retirements and some changes. So when I came in there, it was really trying to refocus. I knew I had a great group of people to work with. We had, we're fortunate to live in a growing community. So we've got a tax base, we've got resources there. So I've really been focusing on growing program services, getting us out in the community more. Trying to meet people where they are, and we have that potential. So now we're building that, and we're doing that.
Absolutely. We'll talk about a couple things. I know I've always mentioned that if you had a rendering, I wanted people to see the mobile, okay? And obviously I can put it over here. I want to show people that, because I think for this, if you haven't seen it yet, you do need to come see it. But let me do this. I'm going to see this picture.
It's kind of small.
That's okay. No, it's all right. No, so I want them to see it. I'm going to put it as close as I can to that. But I want them to actually take the opportunity to come by the Board of Health. I mean, I want them to come see this mobile because it's really cool. So let's talk about that first. there's a lot of fun things we're gonna talk about, but I wanna talk about that because I think it's a symbolic part, but it's such a reality of what you can do with that service. So talk about that.
Yeah, and part of what I talked about as far as our mission to get out in the community more, to meet people where they are, we needs to do that. So I went to my board and have a tremendously supportive board. If people aren't familiar with local health departments, they're governed by a local board of health. So we have 12 members, they're all Bullitt County residents. They come from a lot of different fields. But I went to them with a proposal, let them know it was probably gonna cost, $250,000.
Yep.
And they were 100% supportive of it. Not only is it the first time we've had a mobile unit, I don't know of any healthcare facility or anyone else really that's had a mobile unit here in Bullitt County. So we just had that delivered right before Christmas last year.
Oh, wow.
And so right before the holidays, couldn't do much then. And then of course we know how the year started out between winter weather, floods, everything else.
It's been an interesting.
So it's taken us a while to get going, but we're excited, and it just provides us a mechanism to really take our services out in the community in a mobile setting. So anything we can do in a mobile setting, we're going to do with this unit.
Yeah, I think the thing for me is that when we look at our community, we always we have to know where we live, right? And so when we think about that, sometimes we talk about the finance piece, that there's a lower income aspect to our community here, and some of them don't have transportation,
Right.
And so that piece is great just for some basic checkups, because a lot of times if you can catch things on the preventive side of this, right, of being able to diagnose certain things before it does get bad, it helps folks to live a healthier life, and then maybe some guidance on what they need to do, but at least now they can get this service.
Yeah, that's one of the things we've already done with it. We were actually back in April up at Northwell High School at a health fair, and we went up there and provided free biometric screens. So people just walk in, no appointments, it was free. It doesn't take 5-10 minutes, and it's just a way for people to sort of get their numbers. There's a lot of conditions, you may not have symptoms, but check your cholesterol, your blood pressure, all those things, and maybe if we help one person, we identify something that they need to follow up on with their doctor, it can make a real difference in their life. So that's something we're looking forward to doing more, working with local governments, working with businesses, just find places we can set up for 3-4 hours and just offer free screens.
Yeah, it's a great service.
One of many things we're going to be doing.
Yeah, I'm really excited about that. I picked that first because I just knew, because of I thank you to your board, and obviously you've got a great team, and everything, when things get performed well, we know that it's because we have a team. I mean, I get the same thing. I've got a great team as well. So, but when it comes to this, I think it's going to continue to be a normal part of life where we can be in places that we need to be on a constant basis, right? And then you guys are targeting that as you plan each calendar year. You know where you need to be when you need to be there.
Well, and sometimes things happen that are unplanned. We had already taken it out a couple times just sort of for promotional sort of education events. But when the flooding hit, there's a need, and obviously with flood water, there's all kinds of bacteria and things in there, so they're involved in cleanup. There's a real risk of infection, so there's a real need to get Tdap vaccine, which is basically tetanus shot. We were fortunate. UL South stepped up and got us a bunch of doses, and we had some of our own. So we had over 200 doses, but the hardest hit areas were Shepherdsville and Lebanon Junction.
That's right.
So for Shepherdsville, our facility's in Shepherdsville, so it's easy for people to get to us. Lebanon Junction, they're trying to clean up, they're dealing with enough.
It was a challenge.
So we took our unit down there, set up right in the middle of town,
that's helpful,
right by City Hall, and we gave out more Tdap vaccines at that one event than we have all total the rest of the time. Because the people were just so happy that we went down there, and it was convenient for them. They didn't have to come to Shepherdsville. They were dealing with enough trying to clean up their homes.
It was
good luck getting service.
That wasn't planned, but we were grateful we had that mobile unit because it allowed us to do that.
Well, two things about the flooding is, first of all, everybody had worked well together. I'm talking about from the EMA down. I mean, everybody did, and that's awesome that you told me that story, because like I said, I know that you do these type of things, but that's excellent during the fall flooding. And then the other piece that you mentioned about sanitizing, because flooding in that water, like in our park right now, we're probably going to open up we've got some delays because we've got to sanitize everything, because the mulch that was in the playground, you had to throw it all away.
That's the thing that people don't think about is it's not just water.
Well, as that water grows, I mean, normally it's in where it's supposed to be, but as it goes outside of that, it's picking up so many other contaminants, especially if it gets into sewage lines and systems, and it's scary.
It's not something you want to take a bath.
If you scrape yourself or cut yourself while you're cleaning, you're going to get an infection. It's going to be ugly.
I think that's great. One of the things I also want to talk about is that we talked about our partnership working together, especially the aquatic center. And that's the first time.
Yeah, there you go.
I have to
no,
talk about
you
it.
got it earlier. You talked about driving by it earlier.
Oh yeah, so I've said the aquatic center twice. I usually say it about 10 times every episode, just to make sure everybody knows we have an
Feel like
aquatic
it's a
center.
challenge to see how
bingo
many
card,
times.
everything like that.
But I do think for us, one of those conversations that Rob and I had, and it was last year sometime, we were talking about how we're going to partner with this. And they're willing to be that partner for us because we do talk about health as an integral part. And for us, again, knowing our community and having a free service. So one of the things that we're going to do, and we're working on our management team, going to work with them and getting them in place, but we want them to know part of our mission, and it's a cost to us, is that we want to have senior citizens programs, the water aerobics. I know that we've talked about, right? And I think that's the piece that we want people to know that we're going to have a nice facility, but let's utilize it to keep ourselves healthier. Let's work on that piece. We're also going to work with moms and dads having infants to 4-year-olds at no charge, have their kid used to being around water. Because if your neighbor has a pool and you turn your head for a moment, your child could be in danger of going towards that pool and something really bad happened. We've heard those stories. We even had one locally here. A lady goes to church with us that we're very aware of. So we are looking at those things, and we want it to be affordable and free as can be. It can be free. We're going to do that. So
Right.
we look at those things. But I think with what you do from a health standpoint, that venue is going to be great. We have mayor's walks. We want people just to get out. Just a little bit of walking is a good thing every day.
Yeah, we have, I have staff that has all types of backgrounds and training.
Mm-hmm.
They can conduct a lot of different programs. So we have the expertise, we have the staff. We've got our little facility off these we don't have a big space. So partnering with the city, whether it's Shepherdville, the Aquatic Center, and the park development.
We have the gym as well here.
We partner with Mount Washington, Hillview. We'll to use their facilities. So it's great for us. It allows our staff to be able to have a great venue to put these courses on. And Mary, you and I have talked about just the opportunities that the Aquatic Center and the park improvements are going to provide, because it's going to give us a chance to take our expertise and what we do best and have a great setting to do it in. And we, like we talked about, we want to be a genuine partner where we're not just asking for something.
Sure.
We're going to be providing something.
Oh, absolutely.
So we're willing to put our time, our money, our effort behind it, so we can give those programs to people, as you said, hopefully free of charge.
And we are. That's our goal for that, because like a lot of things I look at, because if it's that, then they're going to do it. Maybe they're going to be more incentivized. And we know as a nation, we have our opportunities when it comes to our health. The fast food and sodas and all the things we know that are evil things, and they're all part of our lives. And so how we moderate those things, but also throwing a little physicality in there, right? A little bit of walking.
So it's bad for you?
I just want to those commercials are
News to me.
Those commercials are lying. It doesn't look like a great experience.
What if they say 0 on them?
Yeah, that's not even a good thing too. Naturally doesn't change things.
And that's probably our number one health. And Bullitt County is not unique to other places. Heart disease is the number one killer.
That's right.
In Bullitt County.
That's right.
And we also have high rates of diabetes and obesity, which lead to those problems.
Right.
And as much as we can encourage people to get out and exercise, eat healthier, that's great. But they have to have opportunities to do that. If the nearest park area is 20 miles away, they're not going to do it.
Yeah,
so developing these facilities, getting them close to people, they're going to be more inclined to visit them and get outside, and anything we can do to provide programs and services to encourage that, we're going to do it.
Yeah, and I think that's the partnership for everybody here in the county. Like I said, I appreciate all my partnerships with all the different entities as far as the county level, because it is about how we work together. Because if we're working in our own directions, we don't get as much accomplished. If we're all together, we have a concerted mission is to take care of the folks that live in our county, right? And we care about everybody else, but we're focused on our folks. I think that outside of the things that I know that you're bringing more awareness, I've listened to how you're keeping expanding. So what is your target goal the next couple of years? What are you going to focus on as far as what people need to know about Bullitt County Health?
And again, we're really working sort of. And it's not just in Bullitt County Health Department, it's public health in general. So much of our time over from 2020 through 22 or 23 was just overwhelmed with COVID. It was all about trying to respond to that pandemic. Sure. And that was not easy on anyone. So now it's nice that we're kind of refocusing and getting back to looking at community health and population health and how can we improve health outcomes. So that's really our focus is, we have all this data, we look at our heart disease rates, we look at our obesity rates, how can we get those lower? So that's where we're focusing our programs and services is in those areas. Again, as public health, we take a more of a community-wide approach to it.
Yep.
So while we're happy to help individuals where we can, we're trying to do programs that can benefit as many people as possible.
Yeah, I mean, we have a small event in February. The heart event.
Oh, the Healthy Hearts Luncheon.
Yeah, it's a great talk. I mean, it really is cool. It's a fun. I mean, but talk about that.
That's so interesting because it started out, I don't know, probably about a dozen years ago. It's just a small little event at our facility, in our little community room. Now we sell out the largest room in the country.
Oh yeah, it's a room.
300+ people every year.
Yeah.
A wonderful event. It's really just to kind of raise awareness of heart disease and heart issues. And U of L Health South has partnered with us the last couple of years to help sponsor it. And
great partner.
They're a wonderful partner. We have physicians that talk about issues, and we've actually had, I think it was 2 years ago, one of the people that attended the luncheon, we really focused on women's heart issues because they're different as far as symptoms.
Mm-hmm.
Not long after the luncheon, she started feeling a little strange and remembered the discussion and the speech that was given there by one of the doctors. So she went and got checked out. Sure enough, she was having a heart attack.
Wow.
And probably wouldn't have done that.
Yeah.
So that's just tremendous to hear those stories.
Yeah, I know I do a lot of talking, but I was actually listening at this luncheon because I mean, it really is very informative. I know it's hard to believe, but it actually did happen because it is informative.
As long as somebody else has a microphone, you know.
Yeah, that's probably what it was.
We make sure we get him far away from the microphone. We make sure the city stable is not anywhere close.
But I do think it is informative, and it's a great group of people because it's all genres. I mean, if you think about it, at different age groups, different ethnicities, we do need to understand that how it affects you is going to be different than how it affects me. But it is important that we have some signals and some things that we keep in mind when it comes to that. But I think you put a big focus on that. The Kids Fest, I think, don't you?
Yeah, we're heavily involved in the Kids Fest. That's in June of every year. One of the things that we partnered with the city the past couple of years is our Family Fest in September. And we had that at the city. We moved around a few different times, but last year was at the city park right across the farm, and we're doing the same location this year. And that's just really a fun event for families to get outside. We usually have 30 or 40 different vendors and booths with giveaways and different activities. So that's a great event that we do every fall. I said usually in September.
Oh yeah. So I guess really as we continue to try to better our community in so many different ways. Health is obviously the number one thing. I mean, we can always talk about a colonic center.
Yeah, well, that's health.
That's health. But all the exciting things we're doing. But I do think it's important for people to realize, the memories we have with our kids and grandkids, I cherish those. So everything I can do to be a little bit better and a little bit healthier, I'm going to work on it. And I think if all of us have some incentive to know, we get it. But, if we can do just a little bit of walking and just a little bit of awareness of the things you do, watch your diet. Obviously, for me, I think it's important. As I've gotten older, it's really more of a challenge, right? Because we used to be able to everything when we were kids. It's not like that today.
And that's what we always try to encourage, is those small steps, those incremental steps. It doesn't have to be a big transformative change. If you're just doing a little bit, every day, every week, just 1% better. Just, cut out one soft drink.
That's what you got to do. Can you do that? Can you do that?
I'll try.
Okay. I'm on the monitor, so I'm going to put a camera on your house.
I'll try to do less Red Bull.
Just get out and walk 20 minutes.
Caffeine is really my...
This is all water here. That's
there you go. There you go.
But just taking short walks, and then maybe after a couple weeks, increase that a little bit. If you make those small changes, that's more likely to stick with you than people that try to do crash diets. Those don't last.
Yeah, they're not really the healthiest things in the world. I know
you do those small changes, develop those small little healthy habits. And
it is habits.
Make a difference.
It is habits. So again, looking at the future of the Bullitt County Health Department, what do you see it looking at like 5 and 10 years? What is it you see some of the outlying things that you want to continue to do? Obviously the mobile unit's awesome.
Right. Well, a couple of things. We do a community health assessment every 5 years. And that's where we, I think last time we did it was 2023. And so we'll be doing another one here in a couple of years. And it's to gauge what the community believes are health priorities.
Okay.
And we had thousands of surveys. We had some public meetings with hundreds of people that showed up. So the last one, a couple of the biggest issues that were identified were substance abuse and mental health. As a result of that, we started a harm reduction program. We'd never had one before.
Talk about that.
So now I have a harm reduction coordinator, and we're growing that program. We now have, I think it's 5 locations where we have naloxone boxes with free Narcan, so people can just go and pick them up. There's no information you have to give, so it's just pretty much anonymous. And we have one at U of L Health's Emergency Department. We have one at the detention center. the Sheriffsville Library, the Mount Washington Library, and then the Health Department.
Okay.
So when we go to any of those locations and get free naloxone, there's also test strips in there. There's resource material on how to get help with addiction. 'Cause that's our ultimate goal.
Right,
We
yeah.
want people to get in recovery. We want
Yeah.
them off addiction. But we got to keep them alive.
Right, yeah,
Yeah,
you want to keep them
absolutely.
alive long
So-
enough to help them.
So that's a program where we're thinking of other ideas where we can grow. We've put together hygiene kits that we provide to the jail that they give to, they screen the inmates to see who would benefit most from them, but they have resource materials, Narcan, as well as just some basic hygiene products. So those that may be unhoused or have some housing insecurity,
Yeah.
they can leave with that kit and maybe give them at least a little bit to get started. We're talking with some of our first responders about, and we would pay for it all and provide leave behind kits where if they go to a scene where there's an overdose, they can leave this packet there because it's likely there could be another one.
Right,
You know,
yeah.
a double dose of Narcan, some material there.
Yeah.
So any way we can get that out to the community more, we're trying to do.
Yeah,
address
it's
those
really,
issues.
it is really understanding that, we've got, the mental health issue has really just soared over the last 10 years. It's probably been out there, but it's being more diagnosed, we're seeing more of that, and then obviously the drug addiction is a challenge.
Yeah.
And so,
talking about COVID didn't have either one of those things.
No.
Yeah, we both-
No, and with mental health, it's in one sense, it's been a positive that people are more willing to talk about it. There's not as much stigma. There's still a fair amount. We're still trying to work through that, but it's getting better. That's one of the things we started last year was a mental health work group. Actually, it was the year before last. And that group has a number of different partners with it. And we last year had our first mental health festival
Oh,
at
wow.
the Central Library.
oh, okay,
And that's going to be an annual event. We're having
Okay.
another one in August.
okay,
August 23rd will be our second
okay.
mental health event, and it's just, it's a free event. We try to have a lot of fun activities and make it inviting for families. We'll have food trucks there. We have all type of kids activities, but there will also be a lot of resources there. So it's a place hopefully people can feel comfortable. There's not a stigma around it.
I think that's a
You
big
can
part.
go there and show up
Yeah.
and not necessarily have to have that, open outward discussion.
That white knuckle
that
feeling,
stigma,
get it, that's right.
Yeah.
but you're going to get access to resources. You're going to find
Oh.
people that can help you, and so we're happy to start. Last year, I think we probably had 300 or 400 people the first
Wow.
time we did it, and so it was
Yeah.
pretty successful for the first time. So we're hoping to continue to grow that every year.
Yeah, I think people are going to find that this community is actually doing the kind of things that we've always expected. We knew that we had a good community, right? We knew that, and we've come together like with the flooding and some of we had the warming centers during the real cold weather when the power outages and those type of things. And then we see this from a mental health or even a drug addiction or alcohol addiction. We're seeing that everybody's trying to figure it out. We've got great church organizations, we've got the nonprofits working on that. But I think really the Bullitt County Health is the point in bringing everybody to you to kind of work that. So that's I know we're working out getting that to be all on the same page. But there are some good organizations just trying to bring awareness to drugs. Just saying no, the old thing, just say no, that's not going to work anymore. There's got to be some real application of talking about this.
Yeah, and we can't do it alone. We're trying to figure out what we can do as an agency to fill some of those gaps. But there are so many other partners out there that are doing great work, and that's why our mental health work group, our partnership prevention group, there's a lot of different partners working there. So those are great to have those work groups because we can kind of coordinate, see who's doing what, share those resources, and then if we see gaps, try to fill those.
Yep.
So we know we can't do everything. We can't fill all those areas, but we're going to try to do everything we can from our perspective, as well as bringing people together to give broader support throughout the whole community.
Yeah, I was going to say this. In the time we've been on this podcast, if people will listen to what you just told us, look at the list of things that you're doing to really be involved with the community. That's why I said, talking about shaking and moving. I mean, since you got an office, we've got a lot of crazy stuff going on, but you are really focused on this health, and I really appreciate what you've been
We've
doing.
also developed an online resource guide. If you go to our website at bullethealth.org, we've got an online resource guide that we've had it for a while, but it wasn't being updated, so we made a real concerted effort to keep it updated. So there's up-to-date information we've got information on substance abuse resources, mental health, housing, all kinds of different resources on there. And it's just a simple, place to go and you can get information on if you're needing help.
And that makes a big difference too, because a lot of it too is just, you can have all this stuff, but if you don't have it easily accessible and things like that, people aren't gonna, especially when people are in situations like that, they're probably not gonna put in the effort to come see you. But if
Well, we're also
like-
trying to take some of what's on there and put it into sort of pamphlets or paper form.
Right,
Because Not
yeah.
everyone has access to internet,
Yeah,
so
that's right.
that way we can get that out to locations where, individuals in need may frequent.
Yeah.
And try to have those.
And you know what, it is really, say, that one, it's focused on that one, right? We know we have a larger part of our community with these issues, but we're not gonna solve that. It's not a zero-sum game,
Right.
it's just because of the social, our society in general, but by one at a time, right?
Mhm.
And I think that's kind of, and having these access and talking about having, just to know that you've got somebody there's no judgment.
Right.
And like I said, with your, having these mental health events every year, that's gonna be something that people can just comfortably go, it's with their kids, you know what? There may be a mom and dad that comes in there that they know they're kind of thinking about things, but they come to this and they can pick up some information. It's just, the kids are having a good time, yet they still have that resource they can get. So I think it's great. I think for me, I know a lot of times it's like we know how important the health issue is, but I think what you've done in a little over 2 years is to really bring out some really good resources. I can't say enough about the mobile unit. I think it's just
Yeah, we're proud of it, and we're hoping that, we're gonna get it out as much as possible. So
Yeah.
people won't need to see a picture of it, they're
Yeah,
gonna see it out in the
yeah,
community
yeah.
as much as we
See it
can,
driving
so.
around.
Yeah, well, they have it in the drive around, but they also have it all the different events.
Right.
Yeah,
You know,
yeah,
I took the
different
tour.
festivals, different fairs,
Yeah.
we're gonna have there just for
Mhm.
informational purposes, but then, as I said, we're gonna be working with businesses to just set up, do free screenings. We actually, are looking to do some additional ones. We had our first, HIV Hep C testing event in May, and
Mhm.
we're gonna be looking at doing
Wow.
additional ones throughout the county. That one's in
Yeah.
Shepherdville.
Yeah.
But we're gonna be looking at Hillview, trying to
Absolutely.
move it around, and
Absolutely.
again, that's free testing. Those are areas that a lot of people may not have symptoms. They may actually already have HIV or Hep C and not have symptoms. If you can identify it early and get treatment, there's very effective treatments.
Yep.
Yeah.
But if you don't, then it can become a serious issue,
And
a
that's-
life-threatening issue.
And that's what we're going back to, all the preventive things we can do. Right? Just get out in front of this before it gets too bad. And I got to tell you, I know that you are a gentleman that's going to get things done. And I think, like you mentioned about your team, but you've got the support of, I know all the cities really do appreciate what you do. And I think if we continue that, we're going to keep bettering our community as we continue to keep growing it. Because I think, at least in Shepherdsville, from my expectation of what I've seen, the family wasn't really focused on. I mean, I don't like to keep talking about Mount Washington, and I was telling him, I tell Stuart all the time, I'm going to say something nice about you, just be careful with that. But it is important. I mean, they're a great community built up. They had a vision with some things, and hopefully when we do that, and as LJ grows, we had a very established in Hillview. These segments of our county, we really are that county. We're a fast-growing county.
Right.
Our population is going to continue to grow, and so when we think about all the things that are going to be in place, what you've started and established, I think, is going to be really vital. It may sometimes be, people don't view it quite the way that we do, but the more people that know that you have these services, the better we are going to be as a community. As we grow, we're going to be healthier. And I know that's your goal.
Yeah, we're excited about where we're going. Like I said, I've been there just a little over 2 years, so a lot of it,
yeah.
up to this point, has been building that foundation.
Mhm.
I've added some staff. I've got more positions. I've got 3 that are out. They're being advertised right now,
Oh, yeah.
and I've got others in my
Yeah.
budget for next year. So growing that staff, having the people in place
absolutely.
to do this work is vital.
Yeah.
But I feel like we're at the point now to where we kind of laid that framework and that foundation, and we're kind of ready to really start taking off with some of these programs to start expanding.
Oh yeah, see, I like people that get things done fast. I like
Yeah.
things that are
Yeah,
always
oh,
going
yeah.
fast.
Oh,
I
yeah.
like fast. I like fast.
But your
I like
coffee
fast.
cup, the Rome wasn't built
Yeah,
today because you
yeah.
weren't on that job.
Yeah.
Yeah, I can be impatient too.
Yeah.
See,
Uh,
and I do think there's some merit to that. Again, obviously they're probably not as used to that pace and the things you're doing. But I think everybody understands that you care about the community just like I care about the community. You grew up here. We've been out here almost 20 years, and we love it out here. I think the best resource we have is our people, and we've seen that in all different departments, and people are owning what we're doing.
So 20, I got you beat by about 30 years.
No, you got you got a little bit more. I mean, I grew up in Hardin County. I'm a military brat, but I do think it's important that we do all these things together, and I think that you do a great job with it. And I was excited to have you. A lot of times, I think more people, if they just get to know what you're doing in Board of Health, they can see the value. They always knew it was there, the resources you're making for people available, that's gonna be great.
Yeah, there's a lot of people that have no idea what the health department does.
Yeah.
They they think about our
Yes.
clinic and our nurse, and that's about it.
And inspections, right?
And I tell people all the time that if you've ever eaten in a restaurant or stayed in a hotel, you were affected by your health
Right,
department.
that's
Because we
right.
inspect all those facilities, and
That's
of course,
right.
that's where some of our, best stories come from, is
Oh, yeah.
that
Oh,
you
yeah.
see there.
We're gonna say that for another
Yeah.
episode. We're gonna bring them back.
That can get interesting.
We're gonna bring back part 2. Health department.
My environmental health director can tell you some really good stories.
Yeah.
It's all good. It's all good. But listen, I appreciate you being on the show, and I want to make sure people know all of your information, and you have an email address that you want people to know to reach out.
If they go to bullethealth.org, there's a form on there that they can contact us. It's contact BCHD,
Okay.
at bullethealth.org.
Absolutely.
So yeah, our website, social media, we're always posting information about events. We get health alerts and food recalls. There are times we'll post something on our social media about a food recall, and I'll see it on the news 3 days later.
Oh,
So we
really?
get that information
So,
well in advance.
Yeah.
First.
So people follow us on social media,
Yep.
check our website. That's the best place to get the information.
All right. Well, we're always going to make sure, Amber, I know it's my community planner here, so anything you want us to put out there, we'll always make sure that. But listen, I appreciate you being on the show, but there's only one tough thing you got to do. If you listen to any of the shows, it's one of the last thing we do on this show. And do you think he's capable of doing it?
I think.
I mean, he's a lawyer. He's a lawyer, and he's now
He's running the
director.
health department.
Yeah,
Yeah.
so, okay, so we're hoping, I just want to make sure before we get off the show that he can handle this. So on 1, 2, 3, we're going to say love, peace, chicken grease. Love, peace, chicken.
I think
I think he can do it, right?
I've said worse.
See, it's not bad. 1, 2, 3.
Love, peace, chicken grease.
Rob, thank you for being on the show.
Thank
Appreciate
you.
all you do for the community. I know it's going to be an exciting time for our county. Thank you so much for being here.
Thanks a lot. Appreciate it.